Yeah, it's a complicated conversation and even complicated for us to understand as clinicians and prescribers. Um, I don't recall who wrote it, but I remember reading a really wonderful article that talked about inflammation of the blood, right? And so we know if we get stung by a wasp or bit by an ant that we have redness and swelling and discomfort. But what happens when you have that same inflammation that's in the bloodstream and getting from the bloodstream into the blood vessels? And so that's kind of the construct that I present, and we know that inflammation is associated with all manner of cardiovascular outcomes, whether it's atherosclerotic cardiovascular events, heart failure, atrial fibrillation. We know it's associated with progression of kidney disease. So there's something underpinning, and I love the term you use in the introduction, common soil. So when I started in this diabetes and heart disease field some 30 years ago, I had all these slides of a tree with all the leaves on it, and the common soil was hyperglycemia. But I
Right.
think as we've learned, hyperglycemia, although it is a therapeutic target for other reasons, is probably not the common soil of cardiometabolic health and disease. And so I think inflammation goes at the base of that tree now, and drugs that impact it favorably, as do the GLP-1 receptor agonists, um, have a lot of potential in the short and the long term for cardiovascular risk.